This program is brought to you by Community Trust Bank, Medical City, Bid Select, and the Neely School of Business at TCU. Welcome to Platforms, the life-lifting news program for women. Now, here's your host, Siobhan Palmer.
Hey, welcome back everybody to Platforms, a life-lifting news program for women. We're continuing our conversation today with Dr. Chris Bell, who is a general surgeon here at Medical City, Dallas. And as you can see, I went through medical school in record time. It took about an hour. So, Dr. Bell, when we were going to break, we were talking about the single incision laparoscopic procedures and a lot of other exciting technologies on the horizon. Let's talk about some of the patients you've served over your. You look like you're about 16, which is a compliment, but take us through some of the more common surgeries you do here at Medical City and share some studies about some of your patients.
Sure. By far, the most common operation that I do is gallbladder removal. This is a very common operation, and as mentioned in the previous segment, I've been doing some patients via a single incision laparoscopic technique, which has really been exciting. One of the things I really enjoy is seeing those patients back in the office, because most of them will say, you know, this is great, I have no incisions, and really they do have an incision. The only incision is hidden inside the navel.
It's so subtle, it's remarkable, yeah.
Yeah, so cosmetically I think it's been a lot of fun for me to see those patients back in the office.
Without the typical, you know, huge scar or
Right.
whatever like that, yeah.
Right, so that's been great. The other operations that I do a lot of are hernia repairs, and I do hernia repairs laparoscopically here, and that's also been a really great thing because I believe there's less post-operative pain. There's a quicker return to work,
Sure.
which is nice, and cosmetically it's nice not to have some big incision.
Do you work on kidney stones as well? Because I know that's a big problem with people. Can you remove kidney stones laparoscopically?
Now the urologists do that.
Yeah, okay, that's urologists.
They can be removed. A lot of times they will use shock waves to dissolve
break them up, yeah.
But a lot of our urologists, like Dr. Tran here, work on kidney stones a lot, and I do believe they remove them laparoscopically at times.
I'm always interested when I interview physicians asking why you went into this type of career. Do you have doctors in your family, or?
No, my father's a petroleum engineer and my mother's a school teacher, and the way I got into medicine was that I always liked science. I liked biology. When I was a kid, I liked being outside. I liked, you know, animals and hiking and things like that. And I also like people, and so it was a natural crossroads for me.
Sure.
And so I always thought I might end up doing family medicine, but when I got into the operating room during my medical school years, I just was hooked and never looked back.
Oh, that's fantastic. I asked Dr. Dewey when we were interviewing him if you had gone into any other profession, what might you be, Dr. Bell, if you hadn't become a talented surgeon here at Medical City, Dallas?
Well, I've thought a lot about that. I'm a little too short to be an MBA center, which would be my top choice, but I'd have to say being a fighter pilot looks like that would be a lot of fun.
That'd be a pretty cool gig, right?
Yeah, ever since I saw Top Gun, I thought that'd be a pretty neat job. So, but I wear glasses, and so here I am.
There you go. Let's talk about the future of medicine as you see it today. I mean, so many exciting things are happening. You have two boys, and you know, 15, 20 years down the road with top facilities like Medical City Dallas, where do you see healthcare here in the next, say, 10 to 15 years?
I think we have a very exciting time ahead of us. We have a lot of great technology in the specialty of general surgery that's on the horizon. We talked about the single incision laparoscopic surgery, a lot of natural orifice surgery that I think will be developed a lot in the future. And I think Medical City, as it is now, will also be at that time on the cutting edge. And it's really a place, we have some very talented surgeons in all specialties here, and I think that it's going to be an exciting time for the hospital in the future as well.
And also just to wrap, you know, patient care today, years ago, you know, you hear holistic approaches and the combining of Eastern and Western medicine and so forth, but as a surgeon and one-on-one with your patients, do you feel like you approach things now more, you look at the whole patient because you're dealing with people and it's not just a gallbladder, it's not just a, you know.
Absolutely. Part of my practice also deals with bariatrics, and I do weight loss surgery as a small part of my practice. And I always am impressed with patients who take good care of themselves after surgery. They've lost the weight, they get into an exercise regimen, they start eating healthier, and I can see as a physician all the benefits of healthy living. And so I certainly, I think that's important, and the practice of bariatrics has allowed me to observe that.
Well, you look like you're in great shape, and again, I'm sure you embrace that prevention a lot of times is something that helps people long term with their health care and so forth.
Absolutely, and directly in my field, I'd rather you know, treat a surgical problem early than when it's an emergency and a lot more difficult to treat.
Couple more questions. What's the best part about being a surgeon?
The best part by far are the people, the patients that I have the fortune to interact with. I always like to hear about patient stories, about their
what they like to do. Say, yeah.
And I really enjoy meeting patients and getting to know them, and so that's the best part of my job by far. As a surgeon, I think that surgeons in general have the unique benefit of being able to fix a problem and restoring a patient's health on a short term. And so, whereas some other specialties may be dealing with chronic illnesses. And so I'm wired to, you know, identify a problem and fix it, and then see the patients go back to their normal state, and that's rewarding.
Just to wrap up, Dr. Bell, do you tell us about a personal and professional mentor?
I would have to say when I was a fellow in training at UT Southwestern,
which is an outstanding hospital too. Yeah.
I had a lot of excellent mentors there, but it was not until I got into private practice that I learned a tremendous amount from the surgeons who are already in practice here. And there are several, Dr. Lane, Dr. Winter, Dr. Aronoff, all of them are mentors and have taught me a lot in the past 4 or 5 years that I've been here.
Dr. Bell, it's been a pleasure having you on the show. Why don't you leave us with a favorite quote or saying?
My favorite piece of advice or quote I remember from when I was in kindergarten. My kindergarten teacher told me at one point during some point in class, I was probably being mischievous or whatever, and she said, Chris needs to worry about Chris. And I've always remembered that, and for some reason those words ring through my mind all the time.
Love it. Well, Dr. Bell, it's been an absolute pleasure having you on the show. Could you give us a website for your practice that if people want to get more information or contact you?
Yes, the website is www.christopherlbellmd.com.
Dr. Bell, thank you for being on the show. It was fantastic.
More than welcome. Thank you for having me.
High five it. Ladies and gentlemen, that's our show for this week. We'll see you next week on Platforms, a life-lifting program for women.